Hello everyone, and welcome back to my video series over cognitive behavioral therapy. Today we will dive into CBT for anxiety disorders. Anxiety disorders are among the most common mental health conditions, affecting millions worldwide. CBT is one of the most effective treatments for anxiety, focuses on identifying and modifying unhelpful thought patterns and changing avoidance behaviors. This presentation will explore how CBT is applied to specific anxiety disorders, including generalized anxiety disorder, known as GAD, social anxiety disorder, SAD, panic disorder, and phobias. CBT is a gold standard treatment due to its structured, evidence-based approach. So, CBT interventions for generalized anxiety disorder. Generalized anxiety disorder is characterized by excessive, uncontrollable worry about everyday events. Individuals with GAD often struggle with constant what-if thinking, leading to significant distress and impairment. CBT interventions for GAD focuses on cognitive restructuring, helping clients recognize catastrophic thinking and replacing it with more balanced thoughts. Worry exposure, so encouraging clients to sit with their worries instead of avoiding them. Behavioral experiments, so testing fears to challenge the assumption that bad outcomes will always happen. And relaxation techniques, teaching progressive muscle relaxation and deep breathing to help reduce physical tension. So, for example, a client who consistently worries about losing a job may engage in cognitive restructuring to evaluate realistic outcomes and develop coping plans rather than irrational thinking and catastrophizing. Or a client worried about making a mistake at work will track actual errors versus perceived errors. Next, we will look at some techniques for social anxiety disorder and panic disorder. Social anxiety disorder involves an intense fear of social situations, often driven by self-criticism and fear of embarrassment. Individuals may avoid public speaking, social gatherings, or even everyday interactions, reinforcing their anxiety. Some CBT techniques include cognitive restructuring, so identifying and modifying those negative self-beliefs. For example, everyone will think I'm stupid. Exposure therapy, gradual exposure to feared situations, starting with low anxiety tasks, such as ordering coffee, and progressing to more challenging ones, such as giving a presentation. There's also video feedback, so clients may record themselves and review footage to correct distorted self-perceptions. There's also behavior experiments, so testing those assumptions by engaging in feared social interactions and observing the results. A common case study involves a client who fears public speaking. They may begin by practicing self-introductions in small groups before progressing to speaking in larger meetings. Panic disorders are characterized by recurrent panic attacks, which include sudden and intense feelings of fear, shortness of breath, heart palpitations, and dizziness. Many clients fear having another attack and begin avoiding situations, such as crowded place if they were to have a panic attack and the last time was in a crowded place. Some CBT for panic disorders include psychoeducation, teaching clients that panic attacks are not life-threatening, but rather an overactivation of the fight or flight response. There's also interoception exposure, so where we deliberately trigger mild panic symptoms, such as spinning in a chair to mimic dizziness, to reduce fear of bodily sensations in a safe setting. There's also decatastrophizing, which is teaching clients that panic attacks are uncomfortable but not dangerous. There's also cognitive restructuring, so this is kind of the same, where it's, for example, they think I'm having a heart attack. having it changed to be, this is just anxiety and it will pass. And there's also breathing and relaxation techniques, teaching slow breathing exercises to regain control during an attack. So for an example, a client who avoids exercise due to the fear of increased heart rate may engage in gradual exposure to mild physical activity while practicing cognitive reframing. Next, we'll look at CBT for treating phobias. Phobias involve intense and irrational fears of specific objects or situations, such as heights, spiders, flying. Clients with phobias often engage in avoidance behaviors which maintain their fear over time. Some CBT strategies include exposure therapy, systematic desensitization, which is a step-by-step approach where clients gradually face their fear in a controlled way. There's also flooding, so in extreme cases, full exposure to the feared stimulus may be used. So, for example, immediately handling a snake for those who have extreme cases of fear of snakes. Next, we have cognitive restructuring, challenging irrational beliefs about the feared object or situation. We also have relaxing techniques, so teaching breathing techniques and exercises to reduce the physiological arousal. And also new and trending, up and coming, is virtual reality therapy. So this can be used for phobias such as flying, heights, or public speaking. So for example, a client with a fear of flying may first look at pictures of planes, then visit an airport, and finally take a short flight while practicing relaxation techniques. So to conclude, CBT is widely regarded as one of the most effective treatments for anxiety disorders. While research is demonstrating its success in reducing symptoms and preventing relapse, CBT for GAD helps clients challenge catastrophic thinking and reduce excessive worry. CBT for social anxiety focuses on exposure, cognitive restructuring, and behavioral experiment. CBT for panic disorders reduce fear of bodily sensations through interoception exposure. And CBT for phobia helps uses systematic desensitization and exposure therapy to reduce avoidance. And many clients can see significant improvements in as little as 12 to 20 sessions, and CBT's skill-based approach ensures long-term benefits even after therapy ends. Next, we will look at how CBT and their techniques can help those individuals dealing with depression. Thank you.